Hello to everybody. On behalf of our board and especially of our president, Gustavo Estofan, it's a pleasure and an honor for me to present to you our Society for Reproductive Medicine, SAMeR. Thank you for this opportunity to the IFFS. Moving to my presentation, I will summarize SAMeR history, present, and what we are working on. SAMeR was born on June 10th in 1947 with the name of Argentine Society for the Study of Sterility, SAEF. In the first meetings took place in the Hospital of Clínicas in Buenos Aires. On 2003, the name was changed and the society became the Argentine Society for Reproductive Medicine, SAMeR. SAMeR is a non-profit civil association dedicated to promote the study of human fertility in its various aspects, facilitating scientific discussions and publications. We have our own headquarters in downtown area of the city of Buenos Aires, meters from the obelisk. We have our own auditorium equipped to carry out face-to-face and virtual activities, a practice room, and administration offices. In its statute, SAMeR has an organization chart that defines the function and responsibilities of each member of the board of directors, the control committee, the executive committee, the scientific committee, the director of publications, and the ethics committee. The regional activity of the society is under the general direction of regions and are divided into 7 jurisdictions. Currently, about 50 professionals are working in SAMeR in all positions. In terms of number, we are a society of 690 Argentinian members, proudly from all the Argentinian provinces. And we also have 7 members from Latin American countries. The 4 pillars of hard working in SAMeR are teaching, professional certification, medical publication, and accreditation of reproduction centers, and the Argentinian Registry of Assisted Fertilization called RAFA. Our teaching goal is to offer reproductive specialists continuous education. That's why currently we have 12 courses running, and also we care for the non-medical team working in the centers. So we have courses for psychologists, nurses, instrumentists, and administrative people. Also, we have a monthly scientific meeting every third Thursday of the month, Argentine SAMeR Congress every 2 years, and virtual regional meetings with conferences and clinical cases presentation. In terms of publications, we have our own journal. The first number of the Reproduction magazine was published in 1986. Since 2020, we have our Revista Reproducción indexed, and we have 2 publications per year. Since 1995, we carry out professional certifications, and in 2013, with the aim of establishing a qualitative improvement in the professional training and certification process, the Professional Training and Evaluation Council was created, called COFEP. An agreement was signed with the National Academy of Medicine, through which it is homologated the title of specialist in reproductive medicine. And in 2022, we released a web service of curriculum vitae online to keep track of the professional training and professional credits to become a certified or recertified specialist. The initial work of COFEP was based on 2 pillars: the creation of a master's degree in order to be able to respond to the doctor who has finished his residency in gynecology and wants to deepen his knowledge in reproductive medicine, and the certification and recertification of gynecologists with the aim of guaranteeing the continuous training. To date, we have 244 specialists from 19 provinces of 24. The external evaluation system for the accreditation of centers began to develop in Argentina in 1997, and in 2004, given the large number of new centers, the board of directors adopted a model of the Latin American Network of Assisted Reproduction, and thus began the Argentinian program from accreditation of SAMeR centers, with the application of a new series of requirements that were verified when the corresponding visit to the center was carried out by an accreditor. Finally, in 2011, the accreditation visits began to be carried out by a team of external evaluators qualified for the specialty. This committee decides the categorization of the center visited according to the results of the validation of the compliance data of the standards and the annual efficiency rate obtained and compared with the reference value of the evaluated period of the Argentine Registry of Assisted Fertilization, RAFA. The RAFA began to collect of data from different centers in 2004 and in a more structured way in 2011. Up to 2019, there were 48 reporting centers, of which 18 were accredited centers and 30 non-accredited centers. It is especially to say that registration is voluntary for the centers. And what about the Argentinian health system and ART regulation in our country? We have a wide, long country of about 45 million people. Although it's a wide country, we have 24 provinces, but most of the people concentrated in 6 or 7 big cities. Our national health system is divided in 3 sectors: the public, social security, and private. The public sector is made up of the national and provincial ministries and the network of hospitals and public health centers that provide free care to anyone who demands it, mainly to the people without social security and without the ability to pay. This sector is financed with fiscal resources. The social security sector is organized with the national or province's social security. It is founded with the payments of the workers and employees, and they provide care through their own system or contract professionals or private hospitals or clinics. And then we have the private sector, who are people who pays an insurance, and depending the amount they pay, they get access to different care with the professionals or private hospitals. But the government established through the mandatory medical plan called PMO, what is the minimum coverage that every person must receive in spite of what he or she is paying. So here's the trick, because almost everything is in the PMO. So most of the people receive full care. In terms of numbers, we have 14 million people in the public sector, 28 million people in the national sector, and only 6 million in the private sector. Note that these 14 million people are low resources, so they don't have money to pay for health, and the state have to take care of them. And as we are going to see, in the public sector, they don't have any access to medical practices. For example, ART, in spite the law says something different. Since 2013, in Argentina, we have a law for reproductive medicine. In Latin America, there are only 2 countries with law, Uruguay and Argentina. And our law main objectives are to promote the effective and equal access to assisted human reproduction through the whole territory of Argentinian Republic, the creation of medical assisted reproduction services in public health establishments, and guarantee the quality of the services. And just to mention the most important definitions in our law, we have to say that it defines the services that the public system will have to give to the patients in low and high complexity. It defines the maximum age of women to receive treatment coverage for reproductive medicine, and is set up for 44 years for own eggs and up to 51 years for egg donation. It says that the system has to provide all the cost of diagnosis, treatment and medications for up to 4 IUIs and 3 IVF with own eggs or egg donation. And when we look at the National Registry of Reproductive Centers, we can see that the reality of this law is very difficult and unequal, because we have 24 provinces with 21 public services in different provinces, and mostly only offers IUI, and we have left 6 provinces without any kind of ART services. And in the private sector, we have 129 fertility centers that offer all kinds of fertility treatment. But the qualification of the national ministry is only a building qualification. So there are 129 fertility centers, but only 21 centers from 8 provinces have the accreditation of quality control of SAMeR, which provide assurance of the quality of the clinic results. But as we said before, for now, this accreditation is voluntary. We are working together with the Health Ministry in order to get this accreditation to be mandatory for the centers so we can certify the quality of every center in Argentina. What's more, what we saw is that a main factor that could affect pregnancy rates in egg donation program is to have an efficient quality control, and you are sure that the center applies to this in Argentina only if it's an accredited center and reports all its data to SAMeR registry. In terms of pregnancy rates, per transfer, we saw that unaccredited center has 38% versus 34% for a non-accredited center. So from SAMeR, we are very active working with the Health Ministry to bring ART services to the best standards and to all Argentinian patients. To sum up, we have in Argentina some challenges: improve professional certification process to get more doctors in the program. We have to achieve more centers reporting their annual cycles, clearly install in all facilities a quality control to get better results. Access to ART has much room for improvement, especially to those with low resources. And all this work is thanks to the leadership of all our 37 presidents, to whom we thank all for their work. For last, we would love to invite you to our Congress in September 2022 in Buenos Aires in our 75 years anniversary. Finally, I would like to thanks again to IFFS. Thank you for letting us share our history and work. Thank you.